making decisions, doing your IVF treatment, it's always very difficult to accept the fact that you're going to need IVF in order to get pregnant, because obviously everyone would rather make a baby in the bedroom. Who wants to go to a doctor and get poked and prodded in order to get pregnant? Something which millions of women do in the bedroom all the time. Which means as it is, by the time patients come for IVF, they're a little bit depressed, unhappy, have low self-esteem. And there's a lot of confusion in their minds because they've heard so many things about IVF, but they're not sure what's right, what's wrong. There's so many myths, there's so many misconceptions, there's so many misleading websites. And it seems that everyone who's had a baby has become an infertility expert simply by virtue of the fact that they made a baby in their bedroom themselves. And this is why sometimes making decisions can be so hard. Making decisions is always hard, and it's harder for IVF patients because you know that the success rate is not going to be 100%. There's so many variables, and the problem is you can't control what the final outcome is going to be. The good news is that you should be happy that at least that technological option is available to you. If you'd come to us 60 years ago, we'd have said, look, I'm sorry, the tubes are blocked, I can't do anything, or I'm sorry, your sperm count is 0, we can't do anything for you. Today, the good news is with IVF technology, there's practically no medical problem for any infertile couple we can't solve. So that's the good news. Yes, I understand it's expensive, I understand the outcome is uncertain, I understand it may take time before you get pregnant, but at least there's light at the end of the tunnel. And this is why when we do an IVF cycle, it's very important that you make the decisions for yourself. So you're in control of your life. Now, whenever we make decisions, we partly use our head, we use our logic, we try to be rational, and we partly use our heart. We listen to our emotions, we listen to our feeling. And the fact of the matter is, you can't just use your head and you can't just use your heart. You need to use both. And in fact, it's usually the heart which leads the head. Unfortunately, this is something which doctors often forget. Doctors think of themselves as being scientific professionals who will only think about technology and technical bits and bobs, and this is the treatment you require. And they forget that their patients are hurting on the inside, that the fact that they can't have a baby is disrupting their life, it's disrupting their career, it's disrupting their marriage, it's making their relationship with friends, family and relatives extremely hard. And that's why doctors need to be empathetic. And this is why, as a patient, you need to understand that it's okay to be swayed by whatever your emotions say. After all, you're a human being, you're not a machine. You're not an animal that you don't have feelings, and you need to respond to this. But you also need to find the right blend. And that right thing to do is to listen to both your head and your heart. But at the end of the day, if for whatever reason your gut tells you this is not the right solution for you, please respect your gut. It's important that you own the decision, and just using your head isn't enough, because you need to live with the consequence of that decision for the rest of your life. And if you use both your heart and your head to make a decision you're comfortable with, you'll be happy, you'll be able to keep your baby happy, you'll be able to keep the rest of the family happy. Whereas if you make a decision you're not happy with, everyone's going to be miserable because you're going to be miserable.